Welcome back to What the Gut. I'm your host, Allison, your crunchy gut health mama. And today on the episode, we have got Dr. Amari Kimble. And Dr. Amari has become one of my good friends. She is a chiropractor based out of Memphis, Tennessee. She also does acupuncture and nutrition, and she is super passionate about helping people achieve longevity and health. And she is also a mama, just like me. We have connected over so many things, and this conversation is just a really awesome one if you are a mom. We are going to talk about so many different things, and especially how we as moms can change the world and how we hold all the power. And it's really up to us to set our family and our children and the next generations up for success. So I hope that you enjoy this episode. You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Dr. Amari, we met at a conference in Oxford, Mississippi a few months
Yeah,
ago,
yeah.
and it was awesome to connect with somebody else in the South who is all about health and wellness. And you're a chiropractor in Memphis. You do
hmm
acupuncture and nutrition too. And I did come to Memphis and we met and we sat and talked for like 3 hours. And so we probably could do that again today. There's so many things that we have in common and love to talk about, especially, like I said, for our population here in the South too,
Yeah,
that we focus
yeah.
on. And so, welcome to the podcast.
I'm so excited to be here. Thank you. It was awesome meeting you in Oxford. I didn't even know there were people like you in Oxford. I think we're the same mindset. Like, I didn't know there were more people like me. Yay,
I
you can
know.
help people and just get people eating right and living better lifestyles. It's refreshing, to know you're not out here on this island by yourself, you
Yeah.
know. So it is really awesome to be at that seminar, but also to meet you and then to keep connecting and doing more things. So we keep talking about health and wellness. So
Yeah.
absolutely.
Yeah. And I know that you really started like your wellness journey in high school,
Yeah,
and now you're a mom. You have a son he's 4. Is that
he's
right?
4.
Okay, because my son's 4 too. So I think
Yeah.
that we connected that. And just through becoming a mom and like learning about feeding your child real food
Oh
and
my
everything that
goodness.
comes with
Yeah.
that, like so much of my story is related to that too. But I would love for you to tell me a little bit more, and our listeners, just starting, I guess, with our children, like how can we educate parents on building that gut microbiome for our kids?
Wow, that's a great question, and I'm extremely passionate about that. It starts preconception, and it's not just all on the mother, it's on the father too. Making sure you're eating, you're exercising, your mental space, your spiritual space, all of that affects the development of the child and the embryo. And so while you're pregnant, making sure that you're moving in appropriate ways, that fits you and your lifestyle, but as long as you're doing something, Also making sure that you're eating good, healthy fats while you're pregnant, that you're resting, you're in a good mental space, that you're hydrating, that you're getting, if you can, organic meats and vegetables and fruits and whole grains if you can, if you're getting fresh, freshly milled grains if you can. But just starting from preconception and then conception, and then while you're growing and developing the baby in your womb, that you're giving it the nutrients that it needs, because you're developing those vital organs and joints and ligaments, and everything is, getting its start. So you want to give it all of the preliminary things that it needs, so that when that baby is born, you're already off to a great start, because God has given us everything that we need, so that when we're born, we can just keep going. So I'm very passionate about that. And then if you can, breastfeeding. I'm learning more and more and more about breastfeeding and how important it is, not only for the nutrition, the bond, but also for the development of your teeth and your palate and your tongue, and your airways. I learned that from Dr. Edwards, Dr. Rebecca Edwards, that put on the seminar in Oxford. But, breastfeeding and making sure you get that liquid gold in that baby, even if it's only for a couple of weeks, even if it's only for a couple of days, if you can get a couple of drops in that baby, it's
I
so
know.
worth it, because that is where you start building that gut microbiome with the breastfeeding, but also vaginal births.
Yes.
Coming through the vaginal canal, you get a lot of, healthy bacteria from mom's vaginal canal that helps start to build baby's gut microbiome as well.
So I had my first child was a C-section. Just through my own research
Mhm.
and deciding to have a vaginal birth with my second was when I really started looking at a lot of the research and literature out there. And, you know, babies' guts, like whenever they're inside your womb still, like they are sterile. Their gut is sterile. And if you have a C-section, then they're born into this like sterile environment. And so they're not exposed to the same bacteria, good bacteria from the vaginal canal,
Yeah.
that a baby birthed naturally vaginally would have.
Yeah.
And
Yeah.
so, I mean, even that way, it sets them up for, their life, preconception and then through birth. And so there's just such a rise of C-sections, unnecessary C-sections, I will say,
Yeah.
in the United States right now, I believe. I mean, definitely it's
Absolutely.
necessary at times.
Yeah, oh, for sure,
My
for
third
sure.
child was a C-section and it had to be. He
Yeah.
had to be. He was
Yeah.
not budging. But my first child, she probably did not have to be, but I also
Yeah.
didn't know any different and didn't
Yeah.
question it at that time. Thankfully, I did question it the second time with my second child and
Yeah.
have her naturally. But yeah, I don't think that, I mean, the gut microbiome, some people don't even know what that is. They don't
Yeah.
understand the implications of it, but
Yeah.
it is definitely being researched more and more these days and
Mhm.
becoming more popular. So,
Yeah, and um, they have also done research and shown that there's a decrease in bifidobacteria in the guts of infants, and that's because of the rise in C-sections, but also the increased use of formula as well.
yes.
And I will tell you a personal story about my son. So I did a vaginal birth with him, but he was in NICU for 5 days. And so they started him on formula. And so when we finally got him home, his like he was bloated, he was gassy, he had diarrhea, he had blood in his stools, and that was because he was on the formula. And it took me a while to get him. He was addicted to the formula. I had to get him off of the formula and get him on breast milk. And that was just like such a tough journey. But thankfully, I knew how important it was. So I, didn't give up, but I know a lot of mothers do. And I'm not, you know, but belittling or condemning them, because I know it's hard. And if you don't have the knowledge, then you'd be like, okay, I'm just going to go with the formula, because goodness, everything else is so difficult.
Yeah.
um so I think we have to do a really good job of educating moms, so they know, one, what their options are, and two, that, it's worth it to push through, even if it's really hard, or that you can do a formula and breast milk, or maybe you can find another mother that has, a lot of breast milk that might be willing to donate.
Yeah.
My sister-in-law, she did that. She wasn't producing enough milk for her baby, and so she went to her cousin, and her cousin was producing all kinds of milk. So she would drive from Memphis to Little Rock to get milk for her baby
Yeah.
from her cousin. And so it's like things like that. I think the one thing that's going to save us is mothers. But yeah, vaginal birth, breastfeeding, that is where the gut microbiome begins for children.
Hmm.
But then it's also staying away from all of these snacks and crackers and things that are filled with, glyphosate, herbicides, pesticides, because that completely disrupts your gut microbiome. It completely destroys it. It acts as an antibiotic. And so, there's research that shows, when rats were put on a diet or injected with glyphosate or the Roundup herbicide that you find in a lot of our snacks, like goldfish, Cheez-Its, Ritz crackers, a lot of our, snacks
Just
that we
easy
get.
to grab
Yeah,
things.
easy grab and go snacks. Their gut microbiome was disrupted. Their organs were enlarged. Their brains had increased inflammation, and they saw the same inflammation in their brains that they saw in autistic children and children with ADD and ADHD. And so, not saying that that's the main thing that causes, those attention deficit or neurological disorders, but it definitely contributes, you know?
Well, and glyphosate is a carcinogen and it's banned in other
Mhm,
countries.
mhm,
But
mhm.
we have it here in the US. Like that should tell you something.
Yeah,
And just in relation to that, but also like you were talking about formula and breastfeeding,
yeah,
like I was not breastfed, but I
mhm,
also know like my mom tried and she couldn't.
sure,
And whatever that reason was, I don't know exactly, but also like she wasn't pushed to do it either. Like
mhm,
back then, 30 something years ago, it wasn't this popular and formula was like the thing to do. Like
right,
not
right,
a lot of people breastfed, or at least like where I'm from, right? And
mhm,
so now you see this population, this generation, and our children who have like all of a sudden everybody has ADHD. All of a sudden
yeah,
there's more autistic children. All of a
yeah,
sudden like there's like everybody's obese, everybody's on
yeah,
Ozempic, like
oh
everybody's
my
on
god,
20 different prescription medications. Like
yeah,
does that not click with some people that like something was not right? And
wrong, yeah,
all of these things are not the main reason, but bits and pieces of it. Like it's all connected. And just even like I'm thinking back to with my first child,
yeah,
I was not in the medical field at all whenever I had her. I didn't know
okay,
anything about this. And so like that's kind of what led me into this field. But I remember like being given packs of formula at the hospital. Now, I
right,
did breastfeed her. I didn't give her any formula. I was like, no, I really want to try to breastfeed because before she was
yeah,
born, I did a lot of research. I was like, I really want to try to do this. I've read it's really great for them.
yeah,
I definitely didn't know all the benefits, but I knew it was good, right? And so, but I remember like taking the formula home just in case and like having all of this formula, but not once did anybody try to talk to me about breastfeeding.
yeah,
And so, like with my second and my third child, I was so strict and I had a birth plan and I was like, do not even talk to me about formula. Like, I'm going to turn it
yeah,
down. Just
yeah,
save it for somebody who needs it. Because I
yeah,
mean, definitely like, like you were saying, we're not shaming moms who can't or
no, of
don't,
course not, no,
but but
mm,
there's so much benefit to doing it, right? That's what we're saying. And so I know even like with my third son, my only son, but my third child, he I had complications afterwards. I was in the ICU and I was
mm,
so strict about no, he's not having formula. I had nurses coming in there and helping me pump because I
mhm,
couldn't feed him because
good,
I was like, I'm getting him breast milk.
right,
And,
right,
I'm sitting here like half awake, but they're helping me pump. And I was like, I
yeah,
don't care. Give him the breast milk
do
like
what you gotta
that.
do.
Yes. And
That's that important. That is
yeah, it's
how
that
important it
important.
is.
also you were talking about like moms that donate breast milk and that kind of thing. With my first child, I didn't work for a while after she was born, and I literally just was a milkmaid, and I made so much milk. I donated like 16 gallons
Oh my
to
God,
the
that's
milk bank.
amazing.
And
That's
I'm like,
amazing.
there are so many moms who don't know that, yes, there are places like the Mother's Milk Bank. There are places you can go and
Yeah.
get milk from. They drug
Yeah.
screen you, everything. So
Yeah.
it's not like, oh, I don't know what I'm feeding my child. They screen you really well for that stuff. So you can't be on certain meds and all of that. So I mean, it's liquid gold, right?
It literally, yeah.
So I just it's not emphasized enough in the hospitals either by the nurses and staff there to breastfeed. I think it's starting to be more popular,
It is, it's getting
but
there. You know, they have the lactation consultants and they have pamphlets and stuff that they try to encourage you. It's definitely better, but it
yeah,
could be even better because we know
right.
how imperative it is, especially with the
Yeah.
way our diet and food, are today.
Yeah.
Um,
But also like thinking about just the gut microbiome and
mhm,
antibiotics.
yeah.
Antibiotics for lifesavers, but they are
Oh, for sure. Oh, for sure.
overprescribed these
For
days,
sure.
especially with providers who do telehealth visits. I mean, you can't even look at somebody's ear and see if it's infected, but you could prescribe an antibiotic, and that's what they do, right?
Yeah.
So I'm wondering, what is your opinion on the best way to recover after having to take a round of antibiotics?
Yeah, I agree with you. I mean, when you need it, you need it. Like sometimes you just got to do it, right? And so I like to recover with a good probiotic. There are a lot out there, but I think, I can't remember who did the study, but they took probiotics from like Whole Foods, over the counter from like Costco, Walgreens, and stuff, and they found that half of those probiotics didn't even have bacteria in them. Like they were just
Mhm.
placebo. So making sure that you get a good quality probiotic from, someone like you or someone like me from a good reputable source,
Yeah.
and being on that, to help rebuild that gut microbiome. But not even just that, but adding fermented foods to your diet. So, that's going to be like
Kimchi, kefir.
MG, yeah, kefir. Kefir
Mhm.
is great. Also, pickled foods, pickled beets, things like that. Sauerkraut is good.
Mhm.
Pickles. Be careful with pickles though. Sometimes they have a lot of added stuff. But if you make your own pickles, things like that. But you can also get good probiotics from your vegetables and
Mhm.
from your
Yep.
fruits too. So, just making sure your diet has included, good, whole, healthy fruits and vegetables from the earth. That's what's going to help rebuild that gut microbiome. And then also boosting your immune system too, because your gut is like 70-80% of your immune system. So
Right.
wanting to make sure you're hydrating appropriately, make sure you're moving, exercising, that helps the gut microbiome, you know, doing things like getting in the sunlight, spending at least 20 to 30 minutes in the sun every day, stuff like that while you're doing a round of antibiotics and afterwards. But then also adding in some good herbs like echinacea or andrographis or astragalus to kind of help boost the immune system as you're going through and post antibiotics.
Yeah, I love that. And you were talking about like probiotics and how
Yeah.
like over the counter stuff sometimes is just not credible. And it's
Mhm.
not like it's not third party tested. You've got to definitely get it from a reputable source. But some people out there listening might think, okay, I just need a probiotic. Okay, let me just go get this. But like every time that you have an illness or like want to get healthier, like you can't just go grab a supplement. I want to stress that because I've got people who come to me who are like, okay, but what supplements do I need to take? And it's like, you can take all the supplements in the world, but until your foundation is where
Thank
it
you.
needs to be, like
That's good.
you're like the supplement, you're wasting your money and your
Yeah.
time. You
Yeah.
really are. You've got
Yeah.
to be working on your nutrition, your movement, your
Yeah.
sleep habits. Like,
Mhm.
if you're not working on these things at all, I'm not saying they have to be perfect, but if you're not working on these at all and just wanting to take a bunch of supplements, like that's not what that's for. I mean, there's no quick fix here. It's not a magic pill, you know? And
Right.
so I just know with my own health journey, when I really started focusing on my health and my gut and improving my health, I mean,
Mhm.
I have not been sick. I think I've had like one sinus infection, but I haven't needed any
Right.
antibiotics.
Right.
I haven't had to go to the doctor. I'm sorry, but if you catch me in a clinic, something's really got to be
It's
wrong, you know?
bad.
Like, I'm not doing that. But I mean, just going outside, like you said, sunlight, foods, like
It's
food is
sometimes it's
medicine.
go back to the basics, yeah.
Yes, it is. And it's like, it's okay. It can be challenging. So I'm not going to say it's easy, but like it is so
No, no.
simple. It is so
Yeah,
simple though.
yeah, yeah,
And I think just we overcomplicate it. People overcomplicate it and think like they've got to do all these things, but it's really so much more about like doing less. Like
yeah,
just slow down and just
yeah,
back to the basics.
yeah,
And I've just noticed my immunity has built up so much.
yeah,
I mean, oh, I wasn't even like thinking about this, but
yeah,
okay, so my entire life, like, I mean, I had terrible gut issues my entire life,
right.
but I was always allergic to cats. So
Mm,
my aunt, the one that lives in Memphis, who I stayed
yeah,
at, I stayed with her whenever I met
yeah.
you for your lunch that day. My aunt has always had cats. And every time I would go to her house, like I would like my throat would just itch and I'd
Oh my
sneeze and
gosh.
like have red
Yeah,
like
that's awful.
hives. And
Yeah,
even like at friends' houses, if they had cats outside and I just like walked up to their house, like into their house and the cats were hanging out outside, I would start like coughing. I've always had an allergy to cats. I even went to the allergist and got
yeah,
skin prick tested, but like
yeah,
my daughter went with me. She was probably 5. I mean, this was just a couple years ago, and I got tested to see what I was allergic to, if I was allergic to cats, because I really wanted a cat. I've
yeah,
always had dogs and I really wanted a cat. Okay. Whenever I worked on my gut and like
yeah,
my health, that cat allergy went away. I have 3
absolutely.
cats. I have 3 cats
That's
now that
awesome.
live in my house
That's
that are
awesome.
in this room right now, and, like, I
Yeah,
have not had any problems,
that's
and
awesome.
that blows my mind, and so the story let me tell you the little story, though, how we got there. So my kids really wanted cats, and I have 3 kids, and they found
Yeah.
some kittens, and they were like, "Mom, please," and I was like, "Oh my goodness, what am I supposed to do? Like, I'm either gonna die or I have to get the kids cat. Like, what am I gonna do?" And so they were so cute, my kids. My kids were cute and the cats were cute, and they were
Yes,
like, "Please, mom, please." I was like,
yeah,
"Okay, well, let's just take them and we'll let them be outside cats, right?"
okay.
But then we got them and they were so cute, and I don't wanna put them outside because I don't want them to run
Mhm.
away, and I'm not
Yeah,
allergic anymore. And, I mean, if I can get rid of a cat allergy, like,
yeah.
how many other things are possible,
You
you
can
know?
get rid of a lot of allergies by treating the gut,
And that wasn't
and
even, like
delivered.
yeah,
Mhm.
like, but I wasn't even, like, trying to do that.
It
So
just
now
happened nat
I'm like, "What else can I do?" You know?
Mhm. Yeah, yeah,
Yeah.
because we're
So
told these things and we're supposed to just believe them, and we're labeled. A lot of
yeah.
people attach those like, "Oh, I've got this gluten allergy," or "I've got this lactose allergy," or "I've got high blood pressure," "I've got diabetes," and we latch onto it and we hold on
Mhm.
to it like it becomes a part of us, and I'm like, "No, your
Yeah.
body is able to heal and recover and reverse all of those things. You just have to start with the basics."
Well, and even in conventional medicine though, like that's how they teach providers. I
Yeah,
mean, you know, you go to school and you learn like what are the symptoms? Okay, here's
yeah,
the algorithm. This is
yeah,
what it points to.
yeah,
What's the diagnosis? What's the ICD-10 code?
yeah,
Plug it in, charge
yeah,
them for this, and then what medication do you give them? Oh, it's right here. If that doesn't
mhm.
work, oh, go to the next one. I
This
mean,
one.
it's like
Yeah,
it's very programmed and not personalized. And then
yeah,
like on your file in the computer, that's how you are labeled. Like it's
yeah,
all right there. And
yeah,
so it's like you're not even a person to the provider. You're just
yeah,
like a case study essentially.
yeah,
And
yeah.
so I think a lot of times too, like when I worked in clinic, people would be like, okay, but what do I have? Like, what's my diagnosis? And sometimes
Right,
it's just like a
people
sinus infection. I'm like, it's just a sinus infection. And they're like, okay, well, like, is it bronchitis? Is it upper
yeah,
respiratory? I'm
yeah,
like, I mean, it could be any of those things, honestly, but it doesn't matter because I'm still doing the same thing for
it's
you,
not
you
gonna
know?
change the treatment, yeah,
Yeah, it's not gonna change it, and also, like, I think that having that diagnosis, I say that it's like a diagnosis death sentence because people cling to that. They cling to that. They want that label.
They
I don't
want
know
it.
if they're searching for some kind of like self-identity or something, but they want
It
that label.
is. And I'll tell you, I have a lot of patients, not a lot, but I've had a handful of patients that come in and they're like, but can you just send me for x-rays because I want to see it. I want to know. And I'm like, it's not going to change my treatment. If I use x-rays and imaging as, something to confirm what I already know, not to use it to search for something that I don't know about, and a lot of times I'm like, you're getting better. You don't need imaging, but people, they got to see it. They got to know. They want to have that diagnosis. And I'm like, but once I send them and they get a diagnosis, then they're better.
What do
You
you
know
know?
what I mean? You know what I mean? So there's always that mental aspect to it, that it just gives them relief just knowing. So a lot of times I'll write up the referral. I say, okay, let's go on over there. Just so you can get it, just so you can have that paperwork, just so you can say, you know, but
Well, and I can understand that to an extent. Like, I think just having the peace of mind of like,
sure,
okay,
sure, sure.
am I crazy or is my back really hurting all the
Yeah.
time? Right? Like, is this all psychological or is something like broken or messed up?
Hmm.
But I think where it becomes like a problem is where people don't think about like, okay, well then what? Like, okay, so you get that test done. Well, then what? Okay, you get the diagnosis. Well, then what? Like, I know I've talked to people who are like, I really just want to go see this doctor, see an endocrinologist. Okay,
Hmm.
but what are they going to do for you? Like, but then what? Well,
Hmm.
maybe they'll
That's a
either
good
like
point.
give you a medicine. Okay, but is that what you want? Like, do you want to be
Mhm.
on a medicine? Like maybe you do for a certain time. Maybe you want to use that as a tool to get from point A to point B. Okay,
Sure.
which
Yeah,
is fine, but like
absolutely.
having a plan is so important. And
Mm,
I know that I've just met so many people who are like, oh, well, I don't know. I was just going to like do what they say. Okay. Well, then you're going to end up being on a pill for 20 years. And then somebody's going to come along and be like, well, why are you on this? And you're not even going to remember why. And
yeah,
it just
yeah,
causes so many more issues. I think
yeah,
just being proactive, taking responsibility for your own health, asking your own questions,
absolutely.
asking, okay, like, what are my options? Okay. I don't know what my options are. Even if you go in and you're like, I don't know what I'm doing, but I know these are my questions I'm going to ask.
Right.
Like, I think that's great. Like,
Hmm.
am I going to have to take a medication for this? Can I heal this naturally? If I take a medication, can I get off of it in 6 months? Like, what's the plan to get off of it if I ever want to? Like, all of these things instead of just walking around blindly
Yeah,
trusting this broken system.
yeah, absolutely. And I think it's like people, they wait till it's too late, but we should be doing the things to be preventative now, like
Oh, yeah.
making sure you're eating fruits and vegetables and cooking at home more days out of the week than not, making sure you're moving, making sure you're resting. I think also for the population, but especially for women, we are so stressed. We are stressed. So it's like if you can reduce your stress by like 30 to 40%, that's going to take care of a lot of your ailments, putting your phone down, sitting down at the dinner table together, going for a walk in the afternoon, reading a book instead of watching a TV show or playing, a board game with your family for a family night instead of going to the movies or something. Or going to the movies is fine, but you know what I'm trying to say.
Just
Just
getting away
social
from the screen at
social
least.
interaction, get away from the screen and just, slowing down. We're so go, 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 go that we can't even prioritize going to the grocery store, coming home and cooking a meal.
We can
That's not a
because we can
priority
click
anymore.
list it. We can Instacart it. Why go to the store when you can Instacart
But
it?
then how do your children learn how to grocery shop? How do your children
Right.
learn, how to pick out the best apple and the best broccoli? They don't. Because
Right.
you order from Instacart. I'm not saying there's anything wrong with Instacart. Like it's helpful because in a pinch you need it. But
Look, it is helpful, but I
I've
get what
used
you're
it. I
saying
can't lie.
though. I
But
get
it's
what you're
like
saying there.
we have to, one, be preventative, but also make sure we're teaching our children and the next generation so that this doesn't keep getting worse.
Right.
Oh,
Right.
and so we don't even get to a point where we're labeled and we're searching for these diagnoses, but we can just, not even have the condition or issue to begin with. And I'm very, most chiropractors are about prevention, and especially for like people in their 30s and their 40s. I tell my patients now it's a time for you to start taking care of your body for when you're in your 60s and your 70s. Because if you wait until you get there, you're going to be in trouble. But right now is the time to start making the changes. Because if you
Right.
do it right now, you will have issues. So, I try to really educate my patients on how to eat, how to move, and be aware of social and community interactions as well as, engaging in some type of spiritual health.
Yeah. And you're talking about like just preventative medicine and
Mhm,
prevention. But
mhm.
preventative medicine these days, like it's not, it's a joke. I mean,
Yeah.
preventative medicine these days, the way that it's like, I think defined by conventional standards, it's like
Mhm.
screenings and tools
Yeah.
and
Yeah, that's
and
a good point.
mammograms, which
That's
okay,
a really good point. I'm glad you said
like let me just say
that.
that there's a time and a place for screenings, like, I'm not against
Absolutely.
it,
Yeah.
but I think that and I say this too, like, with everything, unless I flat out say I'm, like, against something, like, I'm very neutral, like, I just want people to be informed, like, know the
Yeah.
pros and cons and make your
Same.
own decision,
Yeah.
but exposing yourself to all of this EMF and radiation all the time, is that doing you more harm than good? And also, if you look at the studies, I cannot remember like who did this study, but there was a study that looked at like how many mammograms, like how many people is that actually saving from breast cancer? It's not saving
The
a lot of
research does
people.
not support. Yeah.
No, it
The
doesn't. And
research
so
does not
it's
support.
like, but what does support preventing breast cancer? Breastfeeding, like eating
Breastfeeding,
healthy diets, staying away from
apricot seeds. Yeah.
xenoestrogens are
Yeah.
huge, huge, which are in a lot of our self-care products.
Plastic.
And then
Yeah.
we like as women, we spray our perfume right here
Perfume.
on our
Yeah.
thyroid and chest.
Yeah.
Why is everybody having breast cancer and
Yeah.
thyroid issues now?
Yeah.
That's a
Yeah.
major contributor, and all of these toxins we're surrounded by. I mean, prevention is all about going back to the basics,
Yeah.
and that's not talked about in clinic, and
Yeah.
mostly because you only have approximately 7 minutes with your patient.
Yeah. How can you educate them on anything in depth?
Right.
Yeah.
But it's not enough to just say diet and lifestyle. If you do like a wellness exam, it's like, are they doing this and this, like diet and lifestyle? Skip, go on to the next things. What
Yeah.
screenings do they have? And it's like,
Yeah.
or why do we keep throwing people in this radiation and EMF exposure when we could be talking to them about diet and lifestyle changes?
Yeah.
And I mean, like, just you were talking about now preparing yourself for when you're older. My
Mhm.
clients and patients that are in their 60s and 70s
Mhm.
have the hardest time trying to instill new habits or
Sure.
healthy habits.
Yeah.
And
Yeah. Because
I'm
it's
over
set in their
here,
way.
yeah, they're set in their ways. And so anyway, like I'm in my 30s and I'm like, I'm going to go ahead and prepare my body so that menopause is a breeze,
Thank you.
so that I
What
live
I'm
to
doing,
be 100.
because menopause is an American thing. Other
Yeah,
other women around the world do not. They go through menopause, but they don't have any of the
not
side
the
effects
extent.
and symptoms that we experience here in America.
Right. Even like talking to your children about these things, like
Yeah.
talking to your children about the menstrual cycle and just like how that's part of how a woman's body works. And, the hormones, how they change throughout menopause. Like I had to learn that in school. Like this is stuff that we need to know just as basic health as
Yeah.
women, as moms. And
Yeah.
you said something earlier about like it all comes back to us mothers and everything, but like it
Yeah.
really does because we're the
Yeah.
ones populating the world.
Yeah.
So it's ladies, you need to listen,
Yeah.
like we are populating the earth here. And if we're not doing it, if we are not the ones to step up and start doing it the right way, then we're
Yeah.
doomed.
Yeah.
I mean,
Absolutely. I mean, it really is on us, on mothers, on
yeah.
women.
Yeah.
Yeah. Taking a stand and making a change.
Look, ooh, I was on fire for a second.
I love it. I love it. I was letting you roll.
Like anything that comes to like motherhood, breastfeeding, birth, like that's something too we can talk about. Like I can't even remember if I told you on my birth story or any of that when we sat and ate lunch. I feel like I've talked about it so much, but I can't remember who I've told it to. But just
Yeah.
like knowing your rights and asking questions.
Yeah.
My
That's
first
cute.
my first birth was a scheduled C-section. I didn't ask any questions. I was told she was going to be a big baby. I didn't know any different. The birth went beautifully. I recovered beautifully. It was fine, but I had a C-section.
Yeah.
So 37 weeks and 5 days into my second pregnancy, my doctor was like, well, do you want to schedule the C-section for this day or this day? And I was like, let me think about this a little bit. And then I sat there and I was like, why are we having another C-section? I didn't
Yeah.
understand that.
Yeah.
Because this baby, the second baby, I was not gaining a lot of weight with. She was definitely smaller. And I was told my first baby was a C-section because she was going to be big. And she was big, but she wasn't as big as they thought she would be. And
Mm-hmm.
so I was like, I just don't understand that. Well, it wasn't company policy to
Mm-hmm.
have a vaginal birth after
After
C-section.
having
That's
C-section.
why.
Yep. Yep.
So my health is in the hands of not my
A
doctor,
policy.
but a policy.
Policy.
Okay. So then I asked my doctor, I said, okay, so is there a medical reason? And she told me no.
There's not.
And I will forever be so thankful for her. I love this lady, that doctor, so much
Mhm.
because she was so honest with me. She is a
Okay.
wonderful doctor. And
Yeah.
she gave me the names of other doctors who would respect what I
Yeah.
wanted and their
And
companies would.
mhm.
And I switched doctors at
Yeah.
37 weeks and 5
Oh yeah.
days.
Oh yeah.
I went and I interviewed doctors who would do
Yeah.
what I
You have
wanted.
to. You have
Yes.
to.
And
You have to be
so,
willing to change your
yes.
doctor.
And that was one of the best experiences and most like, oh my gosh, exhausting,
Yeah.
terrible
Yeah.
experiences that I've ever had because I had not prepared my body for natural birth. Let's just say
Yeah.
that. And so to get her earth side took about 2 days and
Yeah.
she was a natural birth and she was
Yeah.
sunny side up. And so
Yeah.
it was just all the mixture of wonderful, painful things that labor comes with, but it was
Yeah.
awesome because I got to do what I wanted to do. I stood up
Yeah.
for what I believed in and what was
Yeah.
best for my baby because
Right.
she also
Because
was
you, at
born.
the end of the day, you know what's best for your child.
Yes, and I'm so glad that I did that because then that all of that empowerment carried on with me throughout the third birth of my son.
Yeah.
And so just asking your doctor questions, asking why.
Yeah.
And
Push
if they
back.
say
Yeah.
they don't know, I just want to say, like, tell them thank you because they are
And go
being
find
humble
somebody else.
enough to
Yeah.
not lie to you, to tell you
Mhm.
they're not an expert in
Mhm.
it. Like, respect that. They don't know
Yeah.
everything. I mean, like, they don't even teach them anything about nutrition in school, or nurse practitioners don't teach us anything
Really.
about
Yeah.
nutrition in school.
Yeah.
So, all of that extra education is if you want to take it and continue in education courses.
Yeah. You got to do it outside of
Uh-huh.
school. But, I had a
So, yeah.
similar experience when I had my son. She was like, oh, we're just going to induce you at 39 weeks. And I said, no, we're not.
No, we're not.
I left her. I think I would have been 37, 38 weeks. I left her and found another doctor.
That's awesome.
Had
Yeah,
to
but, like,
Because
I
I was like,
remember
I don't want to be induced. I want to let this happen the way God intended it. You're telling
yeah,
me, as long as women have been giving birth on this earth, that my body doesn't know what to do.
that's what they're
You're,
telling you.
you're telling me that my body doesn't know what to do, that you, with your chemicals, medical, hospital mindset, are going to be better at giving birth in my body than I will with what
Right.
God gave me. No, absolutely
Mm-mm.
not. Mm-mm.
Well, I'm not for or against one or the other, but I want people to know their options.
Yeah,
And
you got options.
even like, so with my third baby, with my son, I just did so much research because I was like, okay, I had a C-section. Now I had a VBAC, the vaginal birth after cesarean.
Yeah.
I wanted to have this baby at home. Mary had Jesus in a stable.
Mhm,
Why can't I have this
mhm.
baby in my bathtub? Right.
Yeah.
And so doing that or wanting to do that, I did my research though, because I was like, I want to have a backup plan. Things go wrong.
Yeah, for
I
sure.
understand this.
Absolutely.
I had my backup plan in place. And thank goodness I did, because I actually needed that.
Yeah.
I did labor at home with him in that bathtub for
But that
12
was great.
hours.
Yeah.
I had a wonderful midwife who was
Yeah.
very educated, who I looked into. I did my
And
research
they're great
beforehand.
midwives, like, bless them,
Yes.
because
And
they
she,
know.
yes.
They
And
know. They're like, if they can't do it, they'll say, this is, you gotta go.
well,
You know?
and his heart rate went down one time. She was monitoring me the entire time, and his heart rate dropped one time. And she said, let's go ahead and go to the hospital. You've been doing this for 12 hours. His heart rate dropped one time. You're tired. Let's go to the hospital. And I said, okay, yeah, you're right. Like, I'm done. Like, these contractions are no joke. And at that point, I was like, okay, just do what you got to do. He was born C-section. It was beautiful.
Yeah.
But that night, hours later, I went into hypovolemic shock. And
Mm.
my uterine artery had ruptured
Oh
from,
my God.
they don't know exactly why. I mean, it could have been from the pressure of pushing for so long. It could have been because he was a big baby. Whatever the reason why was, I don't know. But I was in that hospital, and modern medicine saved my life. So I'm
Absolutely.
all for that.
Yes, for
But
sure.
I had my backup plan in place. I did my research.
Yeah.
Thank goodness the Lord put all those people in my life to help me and save
Yes.
me. But,
Yeah.
had I not done my research and just been like, I'm just going to do this at home. And then later that night, I started bleeding out, I wouldn't have made it
Yeah.
to the hospital,
Yeah. Yeah.
So I think knowing what's best for your body, whether that is getting induced, whether
Yeah.
that is a
Yeah.
C-section, just look into it, because I know, like, I looked into, like, okay, well, the drugs that they give you, if they induce you, what is that
Yeah.
doing to the baby? How's
Yeah.
that affecting the baby?
Yeah.
How is the gentamicin ointment, the vitamin K shots? How is all of this affecting my baby at birth?
Yeah.
Is it
Yeah.
necessary?
Yeah. You gotta do your
Circumcision,
research because they're
all
not
of
gonna
these
tell you. They're
things.
not gonna tell you. Yeah.
Right. Or they're just going to give you maybe the most up-to-date information that they're told from school, but they haven't even done their research.
Yeah.
I mean, whenever you go to school as a doctor or nurse practitioner, like, you don't have time to ask why. You just do what they say. You
Yeah.
just do what you're taught, right?
Yeah.
And
Yeah.
so, and then even out in the real world, you're thrown to the wolves once you get in clinic.
Absolutely. So it's
So,
just
yeah.
important to know that you have options, whichever way you
Yes.
go, because whatever you decide is the best thing for you, but knowing that there are other options out there. So be sure to explore all of them and take your time researching and ask questions. And don't be afraid to change doctors, no matter
Right.
where you're at, how far you're in, what's going on. Listen, I went to 6 pediatricians before I found one that I liked.
I remember
6.
you telling me this. Yeah.
6. I had 3 OBs before I found one that I liked. So I think when we're looking for a new computer or a refrigerator, we go look at all the stores. We look at all on Amazon. We look at about 10 of them. So when it comes to your health, it should be the same thing.
Yeah, I agree. I agree. I think that people don't realize that, like, you're hiring them to work
Yeah,
for you and to
they
take
work
care
for
of
you,
you.
not the other way around.
Right. So find somebody who is going to be an advocate for you, be on your side, and support you with your goals, with what you
Absolutely.
want. Hmm.
Absolutely. Yeah.
Yeah. Well, look, this has been an awesome podcast episode. We could
It was
talk
so fast.
forever. We
I
could
was like,
talk
has it been an hour
forever.
already? Oh my
I
gosh.
know. I know.
We're
But
getting started.
yeah. But thank you so much for being on here today. This was
Thanks for
really
having me.
awesome.
Yeah, this was fun. I enjoyed it.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to AllisonandWellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at AllisonandWellness.com. Let's make your journey to holistic health truly transformative.